The vice chair of the Joint Chiefs thinks it may be as high as 60 to 70% among military personnel, that is, who are infected who do not have any symptoms. Dr. Michael Mina of Harvard's School of Public Health says none of these numbers can be fully trusted because they're based on flawed or inadequate testing. He said, quote, "We have been off the mark by huge, huge numbers," end of quote. Aboard the aircraft, the Theodore Roosevelt, one crew member died from the virus. Rough numbers are 40% of the crew members who have the coronavirus are symptomatic. The rest not. New York Hospital, we talked about this yesterday, tested all pregnant women coming to deliver over a 2-week period. Nearly 15% of those who arrived with no symptoms of coronavirus turned out to have it. In Santa Clara, it turns out that random testing suggests that the numbers might have been understated by a factor of 85. In other words, 85 times more people have the coronavirus in Santa Clara County than the authorities said, according to this study. And a random testing of 200 people in Chelsea, Massachusetts revealed that a third of them had the coronavirus without any symptoms. Moral to the story, this may be far more deeply entrenched in our society than we are aware, and a lot of people apparently have it without having any symptoms, which suggests that its death rate, its lethality may be a lot lower than we thought. President Trump is conducting a coronavirus task force as we speak. Let's go to it.
For new infections. We also are seeing improvements in Chicago and Boston, and that has been a great concern for us over the last several weeks, but they appear now to be flattening. Both also Philadelphia and Houston, Atlanta, Nashville, Baltimore, Indianapolis, and St. Louis also appear to be flattening. The D.C. metro area, we don't see a decline yet, so hopefully all of you are still social distancing and doing everything that you can. I wanted to remind everybody of 2 points. When we brought up and the president put out the guidelines for opening up America again, it was very clear to use data and to really work together to mitigate against any resurgence, and also critically to protect the vulnerable. And what we're seeing across rural America and in some of the smaller population states is we're still seeing outbreaks in long-term care facilities. And we asked everyone in phase 1 to make sure that they continued their social distancing in public, to ensure that the vulnerable with comorbidities and other conditions and among the elderly were staying at home, and making sure we're still providing service to them. But as individual Americans, as we begin to open up, we also made it very clear that individual Americans need to continue all of their hygiene pieces, ensuring social distancing, washing hands, not touching their face, and making sure that they're not bringing the virus home to vulnerable individuals within the household. And remember, those were to continue through all 3 phases. And so really want to call people's attention again to the guidelines. We are continuing to see outbreaks in nursing homes and in confined spaces, and I think as Americans we want to stop that, and we have the ability to do that by really paying attention to the guidelines that were to be in all 3 phases. And so I'm calling on the states again to note that an informed community and knowledgeable community is a protected community. So make sure all of your states have your cases visible to the communities so they can make decisions and understand where the virus is in their community and understand how to tackle it with their state and local governments. This will be absolutely critical. And the surveillance that we called for to find asymptomatics before people get sick as an early warning signal. We asked for those to be in the federal clinics, in our inner city, more vulnerable areas, among indigenous populations, and of course in our long-term care facilities and prisons. We really want to support state and local government governments to move forward on these critical monitoring to protect individuals that may be in the most critically vulnerable states. We will continue to see mortality and deaths among our American citizens, particularly in the cities as they begin to move past peak, because deaths will lag. And so we really need to continue to unite and really, really, really support our healthcare providers who are still on the front lines. They have been on the front lines now for weeks and weeks and weeks. And so no matter what city they have been in, they have not seen the relief that we've been able to talk about at the light at the end of the tunnel because of the delay in hospitalizations and deaths. So to our healthcare providers, to our respiratory therapists, and to everyone in the labs, thank you for the work that you're doing to protect Americans and give us one of the lowest mortality rates in the entire world. Thank you.
Thank you very much. Dr. Pitts.
Thank you, Mr. President. And I just want to echo what Dr. Burke said just a few short months ago. I was one of those doctors on the front lines, and I know how terrific they're working and how well they're doing for the American people. And a shout out to them for just the wonderful work that they do every day. So President Trump asked the FDA
This
to
is
remove
FDA
all
Commissioner
unnecessary
Stephen Hahn.
barriers that were in place to help with the development of both diagnostics and therapeutics, and we have done that. I'm here to give you an update on FDA's efforts around serologic tests, which, as you know, are antibody tests, which detect in the blood the natural immunity that someone might develop in response to infection, in this case, COVID-19. These aren't diagnostic tests, but these are tests that actually detect the antibody, so an indication that one has had the infection and has responded. And I think it's important for everyone to understand that the timing of the response of the antibody to the infection
When we
isn't
come
completely
back,
known, but we know
New York Governor Andrew Cuomo said, yeah, President Trump is right. Testing is up to the states. But I thought it was his responsibility.